One of the cool things about PTWired is that we take kind of a marketing approach to everything. So even though we are PTWired, the app is not PTWired. The app is the clinic's app. Everything is 100% custom branded. If you look in Google Play Store, iOS App Store, there are hundreds of apps which are PTWired made apps, but they're all based on the clinic's name. So that's, we're happy to, ask you guys questions about how you currently do things, make a recommendation, or provide just more information on how different situations can impact your workflows and what the implications are. But I think being very mindful about the strategy you choose to implement can be a big, determination factor on whether you're going to be successful or not.
On this episode of the Levels podcast, we have Vikram with PTWired. We're going to be diving deep on RTM and kind of the different options of RTM, because as this kind of new thing of RTM popped up, I feel like so did like 500 RTM companies out of nowhere. And so just kind of figure out like what makes everybody a little bit different from each other, what type of clinic should actually be considering PTWired. If you're in certain states, is there different places we should look at? But thanks for coming on, Vikram. How are you doing today?
Doing great. Thanks so much for having me on, Joey.
All right. So for you, maybe just a little bit of background on kind of PTWired and how it even kind of came about, because we've had some people on where it's like they already kind of had this thing and then it formalized into being RTM, and then some were like a brand new company. So just so people kind of have a good idea of where y'all came from as a company, I guess just kind of walk us through that.
Sure. So yeah, PTWired, we are a patient engagement platform, and we've been around well before RTM. So we actually have been in the space for about 8 years. Obviously, pre-RTM days, our focus was patient engagement, exercise program, and the main kind of metrics that we were looking at affecting were patient dropout, patient retention, and outcomes. When RTM came on the scene a couple of years back, obviously it was a pretty seamless, transition for us to add those features on to track RTM, and obviously it was great news for everybody who'd been doing these types of things for years to be able to now actually bill for those services. So yeah, we were around well before RTM, and obviously have then added a lot of features on after the introduction of RTM.
Okay. And so for y'all, I mean, there's definitely kind of a big bridge of like there's the home exercise programs, there's the softwares for that. There's the RTM exclusive only companies like that. I guess for y'all, what have y'all found to be the benefit of already kind of being one that does both? And maybe what are the cons of someone who would be maybe hopping onto a home exercise program platform that also does PTWired versus maybe something that's separated?
Yeah, so these things go hand in hand quite a bit. With RTM, the requirement is to have some type of device the patient is using that you're using to track them in between these clinic visits. In our case, and in a lot of these other companies' cases, the device is software. So software as a medical device is what's being provided to the patient. So if you're going to provide something to the patient for them to interact with in between visits, obviously, we're going to want to make that device, that thing that they're using, as engaging and as useful to them as possible. So the more utility we can provide in that system, the better, and the more we increase the chances of them actually using it. Because for us to be able to build these codes, they have to actually use it. We have to actually collect data from them. So the more value we can provide, whether that's their exercise videos, whether that's the ability to message their provider, whether that's the ability to access educational content, to track their progress, to gamify the whole experience, to have reminders and notifications to keep them on track, to provide outcome, reports, all these different points of value increase the chances that we can engage patients more and increase the chances that the patients will actually use the system to the level that we need to actually build codes.
Okay. And it sounds like I really could have used this when I was a dental hygienist before, trying to get people to start flossing their teeth. I had no way to gamify any of this stuff because I was a dental hygienist for 4 years before I went back to PT school and everything like that. So the fact that y'all have thought about hey, we need to gamify this, we need to have some of that. So for y'all though, I mean, is there an app for the patient, or how do they actually interact with this? And then after we kind of go through how do they interact, what does it look like for the providers as far as what they need to do on their side?
Sure. Yeah. So there is an app on the patient side. And one of the cool things about PTWired is that we take kind of a marketing approach to everything. So even though we are PTWired, the app is not PTWired. The app is the clinic's app. Everything is 100% custom branded. If you look in the App Store and the Play Store, Google Play Store, iOS App Store, there are hundreds of apps which are PTWired made apps, but they're all based on the clinic's name. So, you've got the Buffalo Rehab Group app, the H2 Health app, all these different apps for these different groups with their name, their logo, their color scheme. The patient never sees our name at all. So then the very first thing the patient sees is that their clinic has basically made their own app. That's kind of the idea we want to give, is basically that this is something the clinic made, keep our name out of it. And then that way, everything, whether they're in the clinic or out of the clinic, is branded to the practice. Once the patient downloads the app, they have their home program on there. They've got exercise videos with HD videos of the exercises assigned to them. Providers can use our videos. They can have their own videos to create those programs. They can create the whole routine in terms of how many days a week they need to do each exercise, and then the patient can mark those off. They'll get achievements and awards as they do those, complete the exercises on the app. They'll also accumulate a streak. There's lots of gamification built in to kind of make it more fun and engaging for the patient. And then they can also leave feedback on specific exercises, message their provider, book appointments depending on how the clinic does their scheduling. We have a lot of integration so the patients can actually view and book their upcoming appointments on the app. Some based on how they do billing, some can even pay their bills on the app. So there's lots of actual customizations that the clinic can add in to make it also not only a patient engagement tool, but a marketing tool to bolster the whole effect that it has on the patient's engagement with the practice.
Okay, and when you say a marketing tool, is that more so just because we have the branded app, or is like you're actually like, hey, someone's been 7 days since last time they're in, it's going to send them a push notification? Like what level of marketing are we actually kind of doing within the app?
Yeah, so there's a lot of things that you can do. For example, you can have the ability to basically make it so that a patient, once they reach a certain level of engagement on the app, they'll get a pop-up asking them to leave a review on Google or Facebook for the practice. So you can have that approach. You can add custom buttons in that link to different pages, such as if you have a blog, if you have a Facebook page, if you have an Instagram page, to kind of add more traffic towards your social media pages. You can even write up a message and click a button to send out a push notification on the app. So every patient will have that popping up on their device, basically saying, hey, free workshop next week. Know anybody that needs PT? Click here to, refer a friend or something like that. It's very modular and customizable on the app. So there's lots of different use cases for how you can use marketing. And one more thing is when the patient first downloads the app, we have the option for like an intro video that a lot of clinics will make, like a branded video, basically saying, welcome to, Success PT. Thanks for coming in. You can book, do all these different things on our app. Thanks for choosing us. Lots of different opportunities to kind of use it as a marketing tool.
Well, that's pretty cool. I know a lot of people of our clients that use PTWired, and I honestly didn't know it did all of that. I knew a lot of people liked it. So for you, I guess one other thing, could it potentially even do like, hey, it's 2 months post discharge? Could it do another push notification, like based on how long they discharge, or is it more so, is it a push notification across everybody? Because I'm thinking like this could be a very easy way to reactivate patients, check in to see how they're doing, stuff like that, versus hoping a front office has enough time to call that person, check in on them, or the PT to have enough time and stuff like that.
Yeah, no, so the way that this is actually something we're working on right now, we're working on it a little bit differently, where it's not through a push notification, but rather through the messaging system, where you can have like an automated message be sent to the patient saying, hey, Doug, it's been 3 months since you've been discharged. How are things going? Things on track? If not, here's a link to book another appointment. And being able to also have that either be in the voice of the PT or the voice of the clinic, if you want to really personalize it while it's still being automated. And then, yeah, they would still get a notification through that, but it'd basically be like you have a new message from, your PT.
Okay, no, that's cool. And so for y'all, I mean, I know you talked about outcomes originally for the home exercise program side of things. Once we kind of layered on RTM and actually like kind of forced therapists to actually pay a little bit more attention to that because there's money tied to it, did y'all notice the difference between the outcomes y'all were getting as PTWired, an HEP only company, versus PTWired, who is HEP plus RTMs? Has there been a delineation there? And I don't know if y'all maybe have that data.
Yeah, and it does definitely tend to vary based on the approach that people take with RTM. Some groups, when they implement RTM, they're basically just introducing the app and billing the first 2 codes, which are just based on the patient's engagement. Whereas other groups, they're trying to build all 4 codes, which would require an additional check-in each calendar month with the patient in between clinic visits. And obviously with the groups that use that method, they're seeing better results. They're seeing more engagement, less dropout. Pretty much across the board, the data for RTM has been very, very positive in terms of how it impacts outcomes and retention. And that's why you're seeing more commercial payers pick up RTM in many, many states. Obviously, it just started with Medicare. Now, a couple of years down the road, lots of commercial payers reimbursing this. And, the data is pretty conclusive across the board. So definitely there is some variance as well in terms of demographic. Obviously, patients that are a little bit more tech savvy will engage more. So you'll see some variance based on different regions where the demographics have different levels of familiarity with technology. But another thing that we try to do in our app is make it so it's as easy as possible to hit those requirements. For example, one thing we do is we integrate with the pedometer of their device to get the patient's step count on a day-by-day basis, which allows us to collect data from the patient even on days where they're not actually opening the app, which makes it much, much easier to hit the requirement, which is that the requirement for the patient usage-based code is 16 days out of 30 of some type of data being collected that we can use to make a clinical decision. So for us being able to collect the patient's step count and then, not require them to actually open the app 16 out of 30 days, because I know there's probably some people listening thinking, yeah, no way my patients are going to open up an app 16 out of 30 days. Yeah, no way. By being able to collect data in other ways, then maybe we only need them to open it, 8 days or 10 days out of the 30 and be able to get other data from them on other days and still be able to build that code.
Yeah, no, that makes sense. Because I mean, we even like with us, we use Slack internally for a lot of our clients. And so like getting them to even check like that many times out of the month is tough. And like they're significantly more motivated to make money than like the average person. And so I could definitely see how it could be tough. But I think some things that maybe, I don't mean, maybe I'll have thought about this, but when I hear we can have step counting, that also tells me, hey, when that patient comes in and they say, hey, I was good until Friday when you did X, Y, Z, and then like they're coming in on a Monday, they're saying there's issues. It's like, well, yeah, it's you did 10 times the amount of steps on Saturday, but you decided to not tell us that when you came in on Monday actually having issues. What did we do on Monday when we hit 15,000 steps when normally you do 4,000? And so there's some of those things you could start to actually kind of see if you're having some issues like that. Or of course, you could figure out if that's a therapist issue and maybe we actually are doing some things that we shouldn't. But even just kind of having some of those baseline metrics of that, it helps. And as even in the weight loss world, it's like, okay, if we start getting our step count higher, that's good. But like if we start doing exercises and we start dieting, typically we start moving less in general because our body's trying to not burn fat because that's our job. And so if we started making them do all these exercises and physical therapy, we may see that they're actually doing really good with all their home exercise stuff, but their step count went down by 50%. So we need to educate them on some of those type things that like, hey, like, I know you're doing a lot with us, but like, that doesn't mean be sedentary outside of that. And so we can kind of start to use that a little bit more because that is a common thing and our bodies want to go towards that. And so for you, I mean, there's the physical therapy side of this though. So it's like, so what do the actual providers themselves have to do? I know y'all kind of have different actual models of services of how much maybe they do versus a done for you option. So what do those options look like with PTWired?
Yeah. So first, we'll have to look at the 4 codes. So there's 4 codes and they really break down into 2 buckets. The first 2 being based on the patient's engagement on the system, and the second 2 being based on the provider's engagement on the system. So for the first 2, there's the setup code, meaning the patient was set up on the device, activated their account. And then the second code is the monitoring or the data transmission code rather, which is basically over the course of a 30-day period, if we can collect 16 days of data from them, then we can build that code. So those 2 are basically, again, based on how much the patient engages. Do they set themselves up on the app? Do they use the system to the extent where we can collect data where, like you're just mentioning in that example, we can start to gain clinical insights, which we can make decisions from. Those 2 codes, the vast majority of what PTs have been doing for years now, even pre-RTM days, there's nothing new there. You're setting them up on a home program and patients are going to engage to a certain level. Some will meet the code requirements, some won't. That's really just having a system that tracks it for you. But in terms of what the PT does, basically no difference, because it's you're just setting them up, and then some will hit the requirements, some won't. Obviously, you can do things a bit differently to encourage them to hit the requirements by basically educating them a bit more on the device, encouraging them a bit more to use the system. But in terms of what you do to set them up, it's the same. The second two codes are the monitoring codes. So that's based on the time that the providers spend monitoring the patient in between those clinic visits, including one live interaction. So the requirement there is 20 minutes of monitoring time over the course of the calendar month, including one live interaction, which is typically a call, basically calling the patient once during the month saying, hey, checking in, how are things going? Were you able to set up the app? What's new? Trying to get some information from them on how they're progressing. Again, to be able to make a clinical, to use that as insight to make clinical decisions, adjustments if needed. So you can go after just the first two codes. You can go after just the second two codes. You don't have to go after all four codes. And some groups, because adding that step of doing the call once per calendar month can be a bit difficult based on how busy the clinic is. Some groups will only go after the first two codes. For our self-service, that's basically, we give you the platform, we give you all the tracking tools, and then it's kind of up to you guys to track everything, fulfill the requirements, build the codes, etc. So we're providing the system with all the tracking for you guys to basically, track everything. The other model that we have is our full service, where we have a PTA or PT that we assign to the team, assigned to the clinic, who basically will fulfill some of the requirements for the clinic. They'll call the patients, they'll explain how to set up the app, they'll gather the insights to then share with the clinical provider, so then the clinical provider can make adjustments if needed. So there's different models there. It really depends on how the clinic works, what the bandwidth is of the clinic. Typically on our demo call, we'll be able to make a recommendation. We'll ask some questions and basically say, look, like this is the model that sounds like the best for you guys based on how the clinic is operating.
Okay. And I guess what would maybe make me be more inclined for needing to be more of the done for you option versus the other, just so someone maybe has that in their head?
Sure. So if you are super booked out, rarely have open slots, don't have providers who have extra time during the day, you probably want the done for you model. Because in that case, where are you going to find the 20 minutes per patient per month to do the monitoring plus do the live call? Probably not going to happen. So I mean, that still means you could build the first two codes pretty successfully. But if you really want to capture all RTM revenue that you can, you'll want to have somebody doing those calls, because not only does that enable you to access those second two codes, but what we see is that the first two codes, the engagement that you get on the app, goes up significantly when you are pursuing the other two codes. So when you are having those more regular check-ins in between clinic visits, the patient tends to use the app more. And it's not rocket science, right? Like you have somebody calling them, explaining the usefulness of the app. So obviously the engagement is going to go up a bit.
Yeah. I mean, it's like anything in like software. The client success manager literally came from the software world. They realized if we actually get people to come on and talk to you, show you how to use it, funny thing, you actually use it and you stay. And so we're pretty much doing the same thing within the physical therapy space, which makes a ton of sense. And so for y'all, I guess the thing that I would be thinking about when I kind of go into like more of the done for you. First of all, actually, before we get into that, done for you, is there any states you currently aren't doing that in? Like maybe y'all don't have a therapist that has coverage in that state?
Yeah, so there's some states where the supervision requirements are basically make it problematic to do that model. Like Oklahoma is an example of that. And then there's some states, like for example, for New York, we have a PT rather than a PTA because there's supervision requirements. The majority of states we are covering now. Obviously, if they, I don't have off the top of my head every single state we don't cover, because it is the vast majority that we do. But if you book a demo with us, we have the full list. We also have it broken down by the requirements, where we can tell you, okay, yeah, in this state we can do it with the PTA. In this state we need a PT that we'd have. So, and we'd be able to tell you both options are available.
Okay. And for you, of course, everybody wants to know the real stuff. How much money is someone actually making on average, maybe per visit or per plan of care? And maybe there's a discrepancy of if we're going after the first two versus all four. But what are you kind of seeing on average across most of y'all's? And I know there's payer mix differences, state differences, and all of those things. But what are y'all kind of seeing rough averages there?
Mhm, mhm. Yeah, so I'll kind of break this down a bit because, like I said, we accommodate lots of different models, lots of different states. We have groups who are three PTs doing self-service, making five figures a month of art from RTM. So that's one example. And we have groups who are doing full service, who are bigger, and the opportunity here is $160 per patient per month. That's if we hit all four codes for a patient on every month. Obviously, that doesn't happen with every single patient. And the groups that use the full service model, definitely there is an increase in the percentage of those who hit all four codes. However, it isn't just the full service model where we staff the PTA. It's more the strategy where a single provider is managing the whole practice. And we have a lot of groups who they do that internally, where they'll basically staff a provider themselves who's just the RTM person. And obviously that's primarily going to be a group which is a bit larger and they have the volume to accommodate that, and to basically require a full-time person who can do that. But if you can do that, then we always say, by all means, that's the best option because you're going to get all the revenue from that. You're going to capture 100% of the revenue for RTM, and you only have to educate one person of your whole staff,
Mhm.
really, with the ins and outs of RTM. So in general, when somebody books a demo with us, we have a calculator where we'll ask you your full payer mix, and we'll run through a lot of different scenarios. We'll say, okay, if you just do self-service and you only go after the first two codes, this is how much money you can make. If you do self-service and you go after all four codes, this is how much money you can make. And it's also broken down by like estimates of, let's say you only have 20% of patients using your app, 50%, 80%, all these different scenarios, how they can all look. Because the reality of it is, like I mentioned, things can vary. The numbers can vary quite a bit with who is using the app in terms of the demographic. And that ties into the payer mix, like you mentioned, because obviously, if Blue Cross is paying and you have a lot of Blue Cross, those types of patients will typically use the system in a different way than a Medicare patient might. On average, obviously, there's going to be exceptions to both, but that can pretty heavily impact the bottom line of it. And also, if devoting a lot of time to RTM makes sense for you. I'll say across the board, everybody should be billing the first two codes. There's absolutely nothing you're losing there. But as far as having a more thorough strategy going after all four codes, that's what it would really make sense to get on a call with us and kind of run through some scenarios and see if it actually does make sense.
Okay, and so for y'all, I mean, maybe a good question here is like if we have like 100 actual patients coming in, if everybody should be tracking on everybody, how many on average percent do people actually activate? I know payer mix difference, but like is if for 100 people coming in, are 50% of the people activating their actual app in there and doing it? Is it like where does that range typically look like for you?
Yeah, so if you're using the model that I mentioned with a pinpoint RTM provider who's doing the services and managing the program, we see 75 to 80% of those 100 who are activating and engaging to the point where we can build all the RTM codes. Basically, any kind of diversion from that recommended model you'll compromise on those numbers if you have everybody doing the self-service. If you only go after the first two codes, then it'll start to go down from there. But yeah, for the groups that we see who have that pinpoint RTM provider, whether it's us or whether it's somebody else, those are the numbers we tend to see.
Okay, and I guess what do you feel like that, because 20 to 25% is still a large amount. Is that because people are elderly, they don't have smartphones kind of thing? Or is that like staff just aren't trained to like literally make them pull out their phone and download it on the first visit? Like where have you seen kind of people kind of fall short of that?
Yeah, it's actually, I think, a bit more on the staff side than on the patient side. Where we see the most success in changing the numbers is in staff education on basically how it's introduced to the patient. The big distinction that can make a massive difference is basically introducing the app as a monitoring tool rather than an educational tool. If the patient views it as an educational tool, yeah, they might watch their videos the first day, second day, maybe even the third, but then after that, they know their exercises, they'll probably just do them. But then if they know of it as a monitoring tool where they say, hey, look, we're really tracking you. We have somebody who's dedicated just to checking in on you in between visits. All of this data we're reviewing on a regular basis to make any changes to your plan of care. That makes a big difference in how much they'll actually engage on the app. And we try to make the app as easy as possible to engage with. For example, like I said, the first couple times you're doing your exercise, you might want to go through one by one, watch every video, mark it as complete one by one. After that, you probably know your exercises. So then we also have a button that they can just hit once that completes all the exercises at once. So that way we make it a bit easier for them to still log everything without having to make it kind of a pain to actually go through and click a bunch of stuff for a patient. So yeah, that's kind of, I think, the best approach to get patient data to really change is actually how the staff introduces it.
No, that's like a golden nugget there. I think most people wouldn't delineate the fact of like monitoring versus education, because if education's not important to them or they think they already know, then why would they care? Where like I'm actually going into like pretty much anything, even in business and stuff, like one of the number one things that pretty much everybody wants from a program on business is accountability. And if you look at even again, going back to the weight loss world, that's why like the people, it's like if I'm just having someone actually, let's say I give you some exercises, tell you to go do this to lose some weight, here's your membership, you'll maybe pay what, 15, 20 bucks for an Anytime Fitness? Like that's pretty much where you're at. Where if I'm doing personal training, it's not that really that personal trainer is doing any different level of actual like treatment there. It's more so they're holding you accountable. So you know if you don't show up,
Right.
that John's going to be calling you saying, where are you at? And they're going to be telling you, hey, you need to push harder here. And so really like accountability is really just measurement. And so that's really kind of what we see on really across everything. And so I think it makes a ton of sense that it's not like education, because most people really just don't care. They just want to know, does it work? Is someone actually paying attention to me? Like we see
Yeah.
this in the marketing world, like half the time they're just like, hey, like I just need to know that my account's being worked. It's like, no, you're good. But like if they don't know that, like it is a very, very, very big difference. And so it's very, very small nuance. But like if y'all don't take anything from this podcast, please, like that is a golden nugget across the board, because that's huge. Because again, it doesn't matter like systems, operations, anything like that. Everybody's always thinking, oh, what's the software I'm going to use? What's this I'm going to use? But like if your staff doesn't think it's important, one, they're probably not going to change how they actually introduce it to the patient. And then if the patient doesn't think it's important, they're not going to actually do what you need them to do. So then your staff is doing crap that doesn't actually result in anything that you want. And so you do have to look at both of those and the psychology behind it. So I think that that is a really big nugget for anybody here. And so for y'all, I would imagine probably one of the harder things for y'all though is when, let's say someone's on another home exercise program software, they want to do RTM, but it's not very good at doing RTM or doesn't have that option at all. What has kind of been the struggles or things that y'all have had to overcome when it comes to maybe switching everybody over to a new HEP program and stuff like that?
Yeah, I mean, there's a learning curve, obviously, for any switch. And, for us, if you're going to do RTM with PTWired, you have to do HEP with PTWired. There's no kind of way to just do RTM with us and then HEP with something else. So if you're not willing to, take a look at another HEP, it doesn't make sense to take a look at I'll tell you that now. I mean, as far as our HEP goes, we try to obviously make it as quick and smooth as possible. We integrate with EMRs. We have the option to do a lot of things like templates and favorites. We have a smart search system, 7,000 exercises. So we try to make it as smooth and simple as possible. But obviously at the beginning, there's a learning curve. And one thing we do offer if somebody switches is what we call template transfer, where basically you can send us what templates you've got in your previous system, and we'll import those in and have them pre-built into PTWired for you, so you don't have to do that from scratch. But yeah, I mean, at the end of the day, there will be like, an hour or so of time that you'll want to block out to basically build out your favorites, build out your templates into PTWired, so then you can kind of hit the ground running.
No, that makes sense. And the fact that y'all have transfers, I didn't know that. That's actually pretty huge, because I know that if I had to switch all that over, I'd probably never switch over. So that's really big there. So like, I mean, really, it's like if you're still doing paper stuff, if you're still on HEP to go, like, come on, guys, like let's level that up a little bit. Whether you use PTWired or not, like those two are pretty rough. So that would be something to kind of look at so that you can kind of have a little bit more formalized process there, because I don't really know how your actual structure is from a payment side of things. And of course, I know it's going to be customized depending on the person. So I'm not going to tell you, hey, what are your specific things? But I don't know if y'all's is more of a monthly kind of thing based on providers, or is it, because once I know that, that would maybe tell me my next question. So are y'all more per provider, per location? Is it more of a per ones that we actually do RTM through, or how do y'all model that, at least overall arching, not necessarily pricing?
Yeah, so we do per provider per month, no limit on patients or any, like that's it. There's no add-ons, nothing like that. No limits on patients added. And, the idea there is we don't want the clinic to basically have to think, do I want to enroll this patient in RTM because it'll cost me X amount of dollars and maybe I won't get any engagement out of it. We want you to enroll everybody in RTM, and then that way you never have to potentially not enroll somebody, and then that would have actually used the app to then, for you to get money out of it.
Yeah, and the reason Vikram's saying this is because there are some softwares that you are getting charged on the ones that you know are for sure not actually getting any reimbursement because that insurance doesn't do it. And so you would actually have to start either picking and choosing or just know that you're essentially kind of going down the rabbit hole of like we're paying for stuff that we know we're not going to get paid back for. And it's like with us with coaching and marketing, like I never really want the front office to have to decide like, hey, like this Blue Cross Blue Shield person pays significantly better than United Healthcare, so let's go ahead and do that. Instead, we let marketing do that. So it's like, hey, we're only going to be doing marketing to our past patients that have the highest payers. So that way our front office just knows anybody that comes in, we treat them all exactly the same. You never have to change that because it does get really weird when it's like, yeah, our Medicare ones pay for RTM really well. Which I know United actually pays decent in a lot of states, but like there's some, maybe you have another one that doesn't pay at all. It's like, yeah, you get the program, you don't get the home exercise program. We'll actually care and check on you later. So that's good that y'all have kind of put that into your model because I know that that is kind of a weird kind of dynamic with some of the models out there. Because I think that that could get really sticky and make your therapist not feel very good about that. And so for y'all, what happens if someone's like a part-time provider? Like, are we adding part-time providers to become an FTE, or is there a different rate for part-time providers, or what does that look like?
Yep, different rate for part-time providers, different rate for PTAs. And other than that, there's just a one-time setup fee and then a yearly fee through Apple. So Apple has a $99 per year fee to have an app on the App Store. Since we do branded apps, that's a cost, obviously. But yeah, that's it. And everything's included. For the vast majority of groups, if you have 2 or 3 patients doing RTM, you'll already be profiting from using the app. So the bar is pretty low for covering the PTWired cost, and obviously everything after that is just going to be profit.
Yeah, and I mean most people are already paying for some type of home exercise program already on top of that, so that makes it a little bit easier to kind of justify it a little bit there if you're paying for something. For y'all, I mean, what do you feel like has kind of been the hardest thing? I mean, because you've got therapists who are trying to transition, maybe HEP, they're having to also transition learning RTM. How have y'all kind of bridged the gap to be a little bit easier there? Like, because like the reason I bring this up, I've got someone who he's got 5 clinics. He started on PTWired and he's like, we actually just did nothing but the home exercise program for 2 months just so my team was used to it. Like, is that a common model, or some people literally like the moment we're onboarded, they're just going straight into it? Or like, what have you seen to be the case for in most clinics?
Yeah, it kind of depends. And again, it depends on the model. So like for that guy with 5 locations, if he has one pinpoint person doing the RTM, he doesn't need his providers to do anything else but the HEP. So what obviously with our system, we try to make it as easy and as encumbering as possible, where you can literally just set up patients and then have it so you'll get a notification via email anytime a new code is eligible to be built, and you don't have to do any other thinking or work around it. So it kind of, again, depends on the approach. It depends what else is going on. We'll have a lot of groups who will add on PTWired when they're making an EMR switch, and then that's something that kind of will also be part of the process. One thing we do as part of our onboarding, so there's really 2 main issues that we see post implementation. One is if there's a gap between the eligible patients who are set up in PTWired and who are actually active patients at the practice. So let's say there's 100 RTM eligible patients. For some reason, only 30, 40, 50 make it into PTWired. So that's one issue we see. One thing we do about a month post go live is what we call a utilization review. We'll have the clinic generate a report from their EMR. We'll have our team generate a report from PTWired and do a cross analysis to basically identify how many patients weren't set up that should have been because they're RTM eligible, give you an exact number amount to say this is the potential revenue being left on the table. That's one issue. The second issue that we'll sometimes see is when there's a gap between eligible codes to be billed and then the codes that were actually submitted. So let's say you have 50 codes that you could have billed, only 25 or 30 make it into actually getting submitted. Obviously, this is the worst case, right? You do all the work, the money's there on the table, and you don't submit the code. So we have the same process. We have a report that you can generate from the EMR. We'll compare that to what's actually submitted in PTWired or eligible, and then again, be able to tell you these are the exact codes. And what this usually comes down to is being able to identify the providers who need more training, because these tend to go with specific providers. These ones, they're doing everything right. These ones, we need to do an additional training session with them. That's how we basically can ensure we have a successful implementation.
And so on those, like let's say that you had 50, only 25 of them got billed. I assume those still could be actually billed retroactively. It's just they would kind of get into the weird issue of we need 30 days between communication thing, or like how does that work?
Yeah, no, you can do addendums to build those codes.
Okay, so they're not completely wasted time there. So there's at least there. We just need to make sure that that's not an ongoing thing kind of across the board then. And so for y'all, I mean, how long is a normal onboarding? I'm sure it depends on how many providers and stuff like that. But like if I said I want to start today, is that like a 1 month, a 3 month, or like what does that typically look like before they go live?
Yeah, so if you tell me you wanted to go live today, it's usually about 2 weeks before you're fully live with the branded apps on the App Store, the Play Store. And then after that, it's not as much an onboarding as it is a kind of customer success journey over the next 2 months, where we'll do the training session, we'll do the utilization review, and we'll do the reimbursement review. And we'll basically continue to do a utilization and reimbursement until we know that your RTM numbers are good. Because, for example, if we see the first utilization review that, half your providers are not setting up patients to the level that they should be, we'll do another one a month later to see, okay, are all those providers on track now? Are there still a couple others that aren't? Same with the RTM, with the reimbursement review to see, make sure that the billing problems are resolved. So those calls will basically continue those until we know, okay, all the workflow items are good to go. You can see exactly how much money you're making from RTM now. And obviously, you know how much you're paying for PTWired, so you're all set now.
Okay, no, that's good. For you, I mean, is there anything else that you're like, hey, like someone really needs to know this either about RTM because I see these mistakes all the time? Or is there anything that like maybe if they're considering it, they need to consider these things? So mistakes and things they maybe want to consider before starting.
Yeah, so one, I think on the billing side, that's always can be difficult depending on what type of systems that the groups use. That's something that, we've learned, quite a bit of the best ways to do it with all these different systems. So I think, that's part of the reason we do that reimbursement review call, as well as to basically figure out, see if they're having any issues on the billing side, how we can help address those. We've devised whole systems related to optimizing RTM billing that start as at the beginning of the month, and then go through the end of the month in terms of different things that you'll do to hold visits, add the codes, things like that, to make it as simple as possible. So I think the billing side, that's something that can be complicated. Other than that, I think it's really just picking the right strategy. There's not a one size fits all strategy for implementing RTM. For example, a group that has a lot of cancellations or open slots can use that time to do the calls themselves and do the monitoring time themselves, and not have to outsource that and give up some of the revenue. Whereas a group that's seeing multiple patients an hour sometimes and never really has a full open slot, there's basically no way you're really going to do that without blocking out specific time to be able to get those codes. So that's, we're happy to ask you guys questions about how you currently do things, make a recommendation, or provide just more information on how different situations can impact your workflows and what the implications are. But I think being very mindful about the strategy you choose to implement can be a big determination factor on whether you're going to be successful or not.
I think the note of no-show cancellation, people doing it during that time, because that's one of the most common questions I get is like, when is my team going to be able to do this? Because 14% is the national no-show cancellation rate, first of all. So like yours may be lower than that, but like that's the average across like 20,000 clinics that were in that study. And so there's a ton of time that you could do that if you're going more of the like DIY, you're doing it your own. Sounds like if you're super full, you'd maybe go for more of an actual like done for you option and stuff like that. But that's a ton of time. And I'll tell you, whether you're scheduled 60-minute one-on-one or you're scheduled like every 30 minutes, double booking, whatever you're doing, every clinic we're in right now, because we have guys that are 30 minutes, we got guys that are 60-minute one-on-one, every therapist says they have no time to do anything. Just so you know. So all of them complain about work-life balance. All of them think they don't have enough time to do their notes, and all of them will fill the schedule with something during that downtime. And so if we can fill that schedule with something that actually produces some revenue, it makes a lot more sense because then we can pay them more. Because there's some people that they literally just do their bonus structure off of RTM. They do it based off of some of those type things. Or like I've actually heard of one recently that they do any RTM period, that all goes to the therapist. All of their regular stuff, it goes to, of course, the business. And so a lot of people want to pay their staff more. And again, you need to make sure like your profit structure is where it needs to be. Don't be paying bonuses on RTM if you're not profitable as a business. But it's a very good way to potentially add some of that, because then, of course, the longer they come, the longer they check out, the longer they do those things, it's going to increase your outcomes, which gets you more referrals, more reviews, more revenue, and happier therapist. But if you're completely slammed across the board and you're saying, let's add RTM on top of it, you also have to account for opportunity cost of someone quitting because you're trying to add extra stuff. And so that's where you may be thinking either you have someone like Vikram do more of the done for you, or we have some people who they just hire a therapist who's in Texas and they do everything kind of online. And that's kind of how they do their point. It's not someone that actually is physically in their actual building, but they're local to them. But maybe that person is on maternity leave or they're on something like that, and they can still do some of those things. And so always think about the balance of your therapist, because it is significantly, not many people are going to add $20,000 a month in RTM in a smaller practice. And that's how much a PT can make you in revenue. So don't cut that just to make a couple thousand in RTM. But we have a lot of therapists who are making very, very good money with RTM. Like that one that was 5 clinics. We were telling him at PPS that we have someone in California that had 3 clinics, and they're multi 4-figure, almost 5 figures with just 3 FTEs. And so he was in the process of doing 2 months of like, I'm going to get everybody used to PTWired and do some home exercise stuff. He heard those numbers. He's like, Monday, we're doing RTM and billing for it. So like he realized how much money he's leaving on the table. So there's a lot of ways that you could be adding this in your clinic. And I think most people need it. And if you're looking for more of the home exercise program on it, I say we've heard nothing but good feedback from anybody that's used PTWired. Vikram doesn't pay me anything for anything I say here. It's just we've had a lot of people who use PTWired. For anybody that's potentially wanting to reach out to you, Vikram, and find out a little bit more about PTWired, where's the best place for them to find you?
Yeah, so PTWired.com, PTWired.com. You can book a demo with us there. Like I said, we'll ask you questions about how you do things, what your payer mix is. We'll run you through numbers, give you a couple scenarios of options. So, and we're happy to be a resource for this, whether it's just to learn more about RTM, even if you're not really considering moving systems at this time. So feel free to book a call with us, and whether you're considering switching or not.
Awesome. That's it. And we'll have all this in the show notes for anybody that's wanting to reach out. So that way it's easier if you're driving or anything like that. But thanks for coming on, Vikram. I think it was awesome for everybody to be able to kind of hear the different options here, and we'll see y'all on the next one.